Hi, I'm Dr. Chrissy Elrod. I'm a licensed therapist and a university professor, and I take big concepts like medical trauma and PTSD, and I break them down for healthcare providers and people who've experienced it. Today, we're discussing a really important topic, which is enhancing our communication with healthcare providers. Talking with our doctors is often a really scary task, so let's dive into the empowering realm of effective communication with our healthcare providers. As a therapist with over 15 years of experience and with personal experience as a breast cancer survivor, I really understand the importance of having your needs, your concerns, and your preferences heard and addressed when it comes to getting healthcare. Today, I want to provide you with some practical advice to help you advocate for yourself during medical appointments. So together we can enhance our communication skills and hopefully empower your voice at your next doctor's appointment. First things first, you need to prepare for your appointment. Jot down any questions or concerns that you have beforehand. Be really specific and clear about what you want to discuss. Consider bringing a trusted friend or family member with you to help you remember any of the important details. Particularly if you've experienced some medical trauma, going into that medical setting can be really overwhelming and traumatizing. So having someone else in there who can actually listen to and logically get the information from your healthcare providers can be really helpful, because once we're in that triggered place, it's really hard for logical information to come in. Having another person in the room who can verify the events as they happen is helpful when you've experienced medical trauma. Take notes and ask for written information from your doctors. During the appointments, try and write things down or request any written follow-up information about your diagnosis or your treatment plan so that you have any important instructions concrete and remembered, so that after the appointment, you're not second-guessing what happened. Having written information also helps you to research and make more informed decisions. Having all this information together at a place that you can go back and look at it again, written, printed out, digital, whatever works for you. Preparation helps you feel more confident and ensures that nothing gets overlooked and that you leave feeling good instead of disappointed. Been there. Be open and honest. You have to share your thoughts, feelings, and worries with your healthcare provider if you want them to do anything about it. They are there to help you, so be honest. This is crucial in making informed decisions about your treatment. Tell them what's going on. They're not there to judge you. They're not there to feel offended by you. They're there to do their job, which is to help you have the best medical experience possible and to save your life. Remember, your voice matters, and your provider needs to understand your unique needs and concerns, and they can't know that unless you talk to them. Your provider should really consider your preferences and work collaboratively to create a treatment plan that aligns with your goals and values. Talk with your friends and family about this so that they can help you communicate your needs if you get into a situation where you feel overwhelmed and you're having a hard time communicating. 3, ask questions and seek clarification. Do not hesitate to ask questions. Clarify what they're telling you about your diagnosis. Ask about any medical jargon you don't understand. What is that word? I've never heard it before. Does this mean this? Your provider should explain things to you in a way that makes sense. Asking questions and seeking clarification for things that you don't understand helps empower you to actively participate in your own healthcare decisions, whatever that means for you, and no matter how many questions you have. Ask more questions about your treatment options. Remember, your voice deserves to be heard, and if it's not being heard, put it out there, yell it out there, express your preferences. This is very important. Be heard. Get a second opinion sometimes. My medical treatment plan ended up being followed through by my second opinion. I just wasn't comfortable in the first one. I was already having weird feelings about my healthcare providers. Even just making the plan, we were not on the same page, so I was not comfortable moving forward. Once I got to the second place, I felt really comfortable, and while I would go on to develop medical trauma and PTSD, this was the best place for me. So if you feel unsure or you want another perspective, don't hesitate to seek out a second opinion. By expressing my concerns, asking questions, and seeking clarification, I got a much deeper understanding of what my treatment options were, why we were making the choices that we were making, and I felt empowered as an active participant of my treatment instead of simply a receiver of my treatment. It's your right to explore different viewpoints and to ensure that the best healthcare decisions are being made in your care. Trust your intuition and advocate for yourself by practicing open and honest communication, asking those questions that need to be asked, and expressing your preferences. You can become an active participant in your healthcare journey too. If you're seeking further guidance or support on enhancing communication with your healthcare providers, take a look at my Substack at drchrissyelrod.substack.com, where you'll find more resources, personal anecdotes, and a community community that understands what you're going through. So together, let's empower your voice and ensure that your needs are met on your path to healing. I'm Dr. Chrissy Elrod. I'm a licensed therapist and a breast cancer survivor, and I break down big concepts like medical trauma and PTSD for healthcare providers and the people who have experienced it. If you have any questions, leave them below. I love answering questions and talking about medical trauma. I look forward to seeing you soon. Have a great day.